Hi, my name is Greg Fell. I'm Director of Public Health in Sheffield. So this is the situation report and epidemiology of the 11th of August. Case rate first, mid 400s per 100,000 over 7 days. Has gone up over recent weeks and now starting to come back down again. I think it will now stabilise at a fairly high rate. That seems to be the trend across most of Yorkshire, most of the country. The obvious explanation for the case rates going up over the last couple of weeks was the many tens of thousands of people that came together for tramlines and its fringe events a couple of weeks ago. 50-odd thousand people came together. Inevitably, there was going to be some risk. The event itself was very well risk managed, but it wasn't risk free. And as a result of the fringe events, case rates went up, coming back down again now. Here, like everywhere else, I suspect they'll stabilise because there are fairly few, if any, restrictions, so the virus will continue to spread. Mainly younger adults, the least well vaccinated, a bit of spread into older age groups, but not much and nothing to be hugely concerned about. So we've been living more normally than we have been at any point in the last 18 months. We're out more, we're mixing more, we've all got more contacts. Accordingly, that gives the virus chance to spread. And that was the cause of the rise in cases over the last couple of weeks. All up, it's not over yet. The roadmap is finished. COVID has not finished with us yet. It's still out there. Sadly, it's still infecting people and it's still harming people. And it doesn't care who it infects. And you know what we can do. Hospitalisations, over the last couple of weeks, the rate at which people are being admitted to hospital is continuing to rise. Discharges are keeping pace, so hospitals aren't becoming more pressured, but they're at a fairly high rate of pressure, as is the rest of the health and social care system, and that matters. Appears to be levelling off slightly, and as a rule, it tends to be younger and unvaccinated people that are being hospitalised. And some of which are still being admitted to intensive care units. So it's still here and it's still harming people. So the roadmap is well over. COVID hasn't finished with us. It's still here. COVID certainly isn't over. It's still here. It's still infecting people at actually a really high rate, and that is causing some concerns, particularly the long-term consequences of COVID, and it will continue to spread unless we try and reduce the chances of spreading. So how? You know the score. Both doses of vaccine. If you haven't had both doses already, it's really, really important to get the second dose. What we're learning about the immune response is that you're not terribly well protected immunity-wise from just dose one. The second dose is the one that matters. So if you haven't had the second dose, please do so immediately. Wearing a face covering in crowded spaces. If you have symptoms, book a test and isolate until you get your result. Those are the things that have stood us in good stead throughout. They still are the most important things to break the spread of the infection. If you don't have symptoms, you can still test yourself regularly with lateral flow device tests, which you can order for free from lots and lots of different places. From Monday the 16th of August, if you've been fully vaccinated, you'll no longer be required to self-isolate if you're a contact of a positive case. People with a positive PCR test will still need to isolate. But if you're a contact of a positive case, you'll need to book a PCR test as soon as possible. And if the result of that is negative, you don't need to isolate for 10 days. So on vaccination, about 78% of over 18s in Sheffield have had their first dose, 64% have had their second dose. Those were the numbers as of late last week, and they'll have gone up a little bit, but not much. 46% of over 18s have not had their second dose. The second dose is the one that really matters, so please encourage everybody to get that as soon as possible. The rate of vaccination coverage has been going up really quite quickly, but has recently started to slow. And again, we're getting into people that are maybe a bit more hesitant. I can only underscore once again that this vaccination program has made a real difference, and it's really important that we all get the second dose of the vaccination. We're making it as easy as we can to get it. The main mass vaccination centre is at Longley Lane, just near the Northern General Hospital, and there are lots of walk-in centres across the city running week in, week out. In particular, it's worth highlighting this week we've got one running in Vestry Hall in Burngreave. No appointment is needed. No registration with the GP is needed. You can walk in and you can get vaccinated. It's really easy. Vaccination of 16 and 17-year-olds. Last week, the Joint Committee on Vaccinations announced that the Pfizer vaccine will be offered to 16 and 17-year-olds. It's important to say that that wasn't a decision taken lightly by the JCVI. It comes after extensive analysis of the trials that had been done and extensive analysis by the regulatory body, the MHRA, which all found the vaccine is effective and safe for use in young people. The safety data for 16, 17-year-olds is comparable to young adults, and no new adverse events were found. We know there's a lot of spread of the virus at the moment in younger age groups, and I'd encourage all those who are eligible to get the vaccine dose as quickly as possible. The arrangements are being put into place to manage this, and we'll update on the detail of the arrangements over the next couple of weeks. Lastly, the vaccine is being offered to 12 to 17-year-olds who are clinically extremely vulnerable. That's been the case for some time, and we've widened that definition a little bit and now includes people between 12 and 15 with severe neurodisabilities, Down syndrome, and immune suppression, and learning disabilities. And again, will be also offered to children and young people who live with an immune suppressed person. Again, the arrangements are being put into place quickly, and we'll be update on that soon.